Lung cancer is the uncontrolled growth of an abnormal cell that starts off in one or both lungs. The abnormal cells do not develop into healthy lung tissue, they divide rapidly and form tumors. As the tumors become larger in a number, they give the lungs ability to provide the bloodstream with oxygen. To prevent lung cancer and other cancers, do not use tobacco. Also, do not smoke. If you do use tobacco, you can reduce your risk of lung cancer by quitting. The risk of lung cancer will gradually decrease with time as your lungs recover. Also, cutting down on how much you smoke may reduce your risk. Also, nicotine gum, medication, nicotine inhaler, nicotine patches, and oral medicines are available for smokers who want to quit smoking. Also, secondhand smoke and radon exposure can start developing lung cancer in your system. Also, to prevent lung cancer when you're a teenager, ways to prevent it is not to start smoking because cigarettes and tobacco are addicting. Also, how to prevent lung cancer when you're an adult is that you should have a good, healthy diet, also not to breathe in toxic fumes or smoke cigarettes. Lung cancer is strongly caused by cigarette smoking, and with about 90% of lung cancers are caused by the tobacco use. Also, smoking a pipe and cigar can be cause to cancer. Also, the tobacco smoke contains over 4,000 chemical compounds. Half of those chemicals are cancer-related. Also, asbestos fibers and silicate fibers that can cause lung tissue to turn into cancer cells in your body. The symptoms of lung cancer often have no symptoms unless it has spread, but the symptoms are usually coughing, blood in the sputum, shortness of breath, wheezing, pain in the chest, also fatigue and pneumonia. You are vulnerable to get lung cancer at any age. The more you smoke, the higher chance you have to get lung cancer. The less you smoke, the lower chance you get to get lung cancer. It does not matter about your gender or race. Everyone is equally vulnerable to the lung cancer if they smoke or any. The treatment of lung cancer may involve radiation therapy, chemotherapy, and surgical removal of the tumor. Radiation therapy can be used to treat and kill the cancer cells. The chemotherapy treatment can also be used to kill the cancer cells, but the side effects of chemotherapy can be damage to blood cells, bruising or bleeding easily, also mouth sores, and lots of hair loss. There is no cure for the lung cancer yet, but scientists are researching to find a cure. The survival rate for lung cancer is a 5-year survival rate. It is lower than many other leading cancers such as colon cancer, breast cancer, and prostate cancer. Over half of the people with lung cancer die within 1 year of being diagnosed. Now that I know more about lung cancer, I should share this information with young teenagers so they do not start smoking. Also, I can tell adults and teenagers about the harsh side effects of the treatment like chemotherapy so they will not want to get lung cancer.